Yeah. Hi, students. I am Dr. Badrinath, and we are studying the subject of pharmacology. In this video, you will see the corticosteroids. Very important topic, corticosteroids. Okay. And these steroids, when it is secreted naturally in our body, it will be like this. Naturally in our body, corticosteroids will be secreted. It is a very important for body building. Okay, our body will be like that. Whereas some people, they are misusing it. Steroids, they are taking extra than the required. For example, say athletes, to show a very performance, or Mr. Perfect bodybuilders, they are taking extra. That causes a very dangerous, very dangerous. See here, this fellow, this person is taking the steroids, excess. Okay, so here you can find these are the some of the symptoms if you are taking extra more body building than this natural person. Okay, see here, this nipple, this comes, it will be projected. This is natural, whereas here it will be projected. And here you can see some of the just like allergy like things, and your cheeks will be, it will be enlarged, widening of the cheeks. So don't take extra steroids. Okay, if your body is unable to secrete the natural steroids, then only you have to take. That is also under the prescription of the doctor. Okay, otherwise you should not supposed to be take the very dangerous if you are taking. Okay, right. So where this corticosteroids comes, see, this is a steroids word is there that you have to keep in your mind. Where this corticosteroids comes, see, this is the steroid classification. See, all the steroids consist of a steroidal backbone. This is the backbone. It consists of a 17 carbon. See here, 17, and additionally one or two. This is only the backbone. Only backbone. Different steroids consist of different structure, but steroidal ring is common for all steroids. 17 carbon steroid is a common. Additionally, one or two extra, three, four extra will be there. That is another part. Steroid means the name itself indicate it consists of a steroidal ring inside. Okay. Steroidal ring consists of a backbone, 17 carbons. Okay. Steroids are divided into corticosteroids. This is our topic. This is the topic, our today's topic. Corticosteroids and androgens. This is another chapter for you. Androgens are separate chapter for you. Okay. That we will discuss in the next videos and all. Okay. Androgens. See, keep in your mind, androgens consist of a 19 carbon atoms. Steroid plus two other carbon atoms consist of a androgens. Okay, corticosteroids are divided into glucocorticoids, mineralocorticoids, glucocorticoids, glucose, just like a gluco. That you point you can remember. Minerals, we know very well minerals, calcium, sodium, potassium, magnesium, etc. All mineralocorticoids, glucocorticoids. All these mineralocorticoids, glucocorticoids consist of a 21 carbon atom. Most of the students are confusing. Very important bit in the competitive examination. Very simple. Steroids consist of a 17 carbon atoms. That okay. Androgens and corticosteroid. Corticosteroid, see here. Corticosteroid C. What is the C in alphabet? 3. So 2 plus 3, 3. Like that you can remember. 21. This is a 19. 20 minus 1, 20 plus 1. 20 plus 1 means 21. Okay, 20, my average is a 20 here, you can keep in your mind. 20 is the average. And in the examination, competitive examination, they will ask you, definitely corticosteroids consist of how many carbon atoms? It is a 21 carbon atom. C here, C is the very important. Okay, both, you know, mineralocorticoids, glucocorticoids, both comes under corticosteroid only. So 21 carbon atoms only. So 2 plus 1, 3, like that you can remember. Here, androgen, it starts with the 1. A is equal to 1. See here, A, alphabet number 1. Here also alphabet number 3. So total 3. Here 1. Like that easily you can remember. You can crack in the competitive examination. 19, 20. Here 20 is the average. This is the syllabus, pharmacology of drugs acting on endocrine system. That is the, in that A, B, C, D, F different parts are there. In the last part, we are going to be see ACTH, adrenocorticotropic hormone, as well as Corticosteroids. That is one of the separate chapter bit, one of the bit in your syllabus chapter. Yeah, these corticosteroids will be secreted by the adrenal gland. So, adrenal gland here, which is present on the kidney. Each kidney is having one adrenal gland on the upper face, on the top of the kidney. Okay, and its structure is like a triangle. Here you can see just like a samosa, triangle samosa. Here also it consists of a, inside some curry will be there. See here, curry is there, no? Veg or egg like that. Here also one curry is there. Okay, this is you imagine that there is one samosa on your each kidney. Okay, like that you can easily remember, and it consists of a 3 layers. All the 3 layers are very important, very important. See, first layer, see my cursor, first layer is which is present at the top, that is a surrounding. It is called as a capsule. Capsule is always outside, we know very well. The capsule also, capsule means outside. Okay, next, inside medulla, it is present in the middle, that's why it is called a medulla. Okay, that is a second part. So first part is the capsule, second part is the medulla, which is present inside, in the middle. In between the capsule and medulla, there is an adrenal cortex. Here you can see, remember, this part, this brown color part is called as a adrenal cortex. That adrenal cortex again consists of a 3 layers. Okay, so total 3 layers. In that, adrenal cortex consists of again 3 layers. Zona glomerulosa. This also is which is present near the capsule. Glomerula, glomerulas are present in the nephrons of the kidney. So it is almost here, it is almost outside of the glomerula, near to the glomerula. That's why. Number 2 is zona fasciculata, zona reticularis. Okay, fasciculata, fascic. Okay, and reticulosa, red, zona red. Like that you can remember, which is almost near to the red, zona reticulosa. In between it is a fascic. Here you can see the glomerula. This layer is near to the, when compared to these two zones, this zone is near to the glomerula of the nephron. That's why we can name it as a zona glomerulosa. Okay. Yeah, here you can see the different structure in the detail. Uh, See, first one is called the capsule. Okay, here you can see the capsule. Next is zona glomerulosa, this part. This zona glomerulosa releases the mineralocorticoids. Number of times it was appeared in the examination. Very important. All this secreted by which part, which zone. Like that in the examination, they will ask definitely. It already appeared in thousands and thousands times. Okay, zona glomerulosa. It secretes the mineralocorticoids. Okay, aldosterone is a wonderful example. It is a mineralocorticoids. How to remember this? All minerals. All minerals. See here, all aldosterone minerals. So all minerals are near to the glomerula. Minerals will be saved in the kidney because aldosterone will collect back. Aldosterone will collect back the minerals from the kidney. It reabsorbs the sodium, potassium, magnesium, calcium, everything it reabsorbs, aldosterone. So all minerals will be catched by the aldosterone. It is present in the, it is glomerulus. So it acts on the glomeruli, nephron. Okay. So next is zona fasciculata, this part. It secretes the glucocorticoids. Both collectively called as corticosteroids. Okay. Glucocorticoids example is a cortisol. See the shape of the letter GC. Almost same, GC. So glucocorticoids means cortisol. Mineralocorticoids means all minerals, aldosterone. Students, they are confusing like anything. So don't get confusion. Very clear. All minerals, corticosteroids, G shape. Okay. And zona reticulosa, the secrets, the androgens. This is also very important. It comes in the next video. Androgens. Androstenodione. See, name itself indicate andro. Here also androgens. Okay. Next, medulla. In the middle, it releases the catecholamines, adrenaline, noradrenaline, epinephrine, norepinephrine, all are same only. Adrenaline, epinephrine, also called as noradrenaline, norepinephrine, all are the synonyms. Okay. So ACTH is one of the important hormone, adrenocorticotropic hormone, that is important for the stimulation of the adrenal gland. Then only adrenal gland will secrete all these chemicals, all these hormones. Okay. So it binds to the MC2R receptor, okay, which is present on the cells of the adrenal cortex. This adrenal cortex consists of these receptor MC2R. Okay. Translocation of the cholesterol. So what happened when adrenocorticotropic hormone binds to this receptor? Cholesterol will be enter into this. That cholesterol is a main parent molecule for this synthesis of all the hormones. All the steroids are obtained from the cholesterol only. Cholesterol is a parent. Cholesterol is a father. Cholesterol is a mother. Okay. So cholesterol has to enter into the adrenal cortex for the synthesis of all these minerals. How it enters means ACTH. ACTH has to bind with the MC2R receptors which are present in the adrenal cortex. Then what happens? All the cholesterol which is present in our body that enters into the adrenal cortex. Okay, so that parent molecule is available. So this started the synthesis of all hormones. Yeah, here you can see the biosynthesis of all adrenal hormones. All adrenal hormones. See here, this is the mineralocorticoids. I have already told no mineralocorticoids. Example is aldosterone, all minerals like that. Glucocorticoids, cortisol, GC shape already told. Sex hormones, androgens. Androgen. See, parent molecule is the cholesterol. Very important. It is a precursor. Pregnenolone. See here, cholesterol will be converted by the ACTH will transfer the cholesterol into the adrenal cortex. It is converted to pregnenolone. Pregnant alone. Okay, pregnant alone. Like that you can remember. These two are very, very important. Cholesterol will be converted into pregnenolone. Then only either mineralocorticoids, glucocorticoids, or androgens will be formed. Okay, from cholesterol, from pregnenolone. Okay. So generally this is not much important for your things, but you can write, you can give skip off all between step cholesterol, pregnenolone, aldosterone. Like that you can write in the exam. Okay. In between you can give skip off. Yeah, here you can see how the regulation of the, this is from your pharmacology book Tripathi. Stress is the main factor for the synthesis of adrenaline. That is a, see, this is a adrenal gland, adrenal medulla, adrenal gland, adrenal cortex. Okay, and here you can see the kidney. ACTH is very, very important hormone. ACTH will be secreted by the anterior pituitary gland. Okay, in the name there is a adrenocorticotropic hormone. So all the students confusing that ACTH adreno is there, so that it is secreted by the adrenal gland. No, adrenocorticotropic hormone secreted by the anterior pituitary gland. It stimulates the adrenal cortex for the synthesis of all these hormones. Just now we saw, no, it MC2R receptors. Okay, like that. So when the in the body, if suppose there is a excess amount of all these aldosterone, see here aldosterone, hydrocortisone, all these, if it is extra, it gives a negative feedback mechanism. It inhibits the hypothalamus to secrete the CRF, and to it also inhibits the anterior pituitary gland to avoid, it avoids the secretion of the ACTH because already excess is there. So need not to be synthesis like that. It gives a signal to the anterior pituitary gland to also no ACTH now. Okay, like that. Yeah, here you can see all the structures. This is the basic molecule I have already told. 17 is there. Okay, here you can get one extra 18. Here one carbon atom, or you can that depends upon the structure. In the 18th position, here you can see in the 19th position, this is the 20th position, 21 position. We know that 21 carbon atoms, 19 carbon atoms, we know, already explained in the step. And this is the groups, and these are the groups which positions. According to that, here the name will come. This is the corticosterone, hydrocortisone, cortisone, prednisolone, triamcinolone, Okay, dexamethasone, betamethasone, all these structures. Okay, if it is okay, this chemistry, in the chemistry it is important. Okay, not here. Yeah, now we will see what is this glucocorticoids actions. See, glucocorticoids example is cortisol. Okay, uh, first one, it affects the carbohydrate, fat, protein measure. I have already told steroids means bodybuilding. Bodybuilding means all the food material, whatever we are taking, that is three forms only: carbohydrates, so proteins, so fats. So, okay, nothing is there. Only three we are taking. Beyond that, nothing is available. That three only we are taking. It will be metabolized by the glucocorticoids. Metabolize, then only you will get energy, you will get a stamina. Okay, and first job is that only. Okay, number two is anti-inflammatory, very good painkillers, very good, excellent painkillers. Actually, all the steroids are painkillers only, but we are taking non-steroidal painkillers like ibuprofen. All those drugs we are taking non-steroidal anti-inflammatory drugs which doesn't consist of steroidal molecule. Actually, steroids are very good painkillers, but we are not using as a painkiller because it reduces the immune system. See here, corticosteroids, very dangerous. It reduces the pain. You will get a pain relief immediately. You will be feel very happy. But what happened? This is your immune system. How you are going to stop the coronavirus? See, this is immune system. And the T cells, T lymphocytes are very important part of the your immune system. T lymphocyte. It will be banned. It will be decreased. Your immune system will be reduced by the corticosteroids. It will be suppressed by the corticosteroids, glucocorticoids. That's why you should not use steroids. That's why don't use in extra. Yeah, it is very good for cancer, though cancer patients. If you are suffering with cancer, your known persons or anything, anti-proliferative action. See here, anti-proliferative. Cancer, see, cell division is very fast in the cancer. You cannot see the cell division also. Very fast divisions will be there. Even you cannot see under the microscope also. Cell division. That much fast will be there. So it suppresses the growth of the malignant cells into the surrounding. So these corticosteroids, glucocorticoids are very good for cancer. It avoids the cancer. Vasoconstrictive, it constricts the blood vessels. See, this is a normal artery, this is the vasoconstriction, so BP will be raised like anything. That is one of the drawback here again. So it is having a positive actions, it is having a negative actions also. Okay, vasoconstriction, this action will be achieved so that BP will be increased. And cortisol showing a, see here, suppresses the immune system. Okay, that we saw. T lymphocytes especially. Next is it decreases the serotonin secretion. Serotonin is a happy hormone. It decreases the serotonin so that you will be like a sad. Otherwise, you will be feel happy ball, just like a happy ball. It is a reverse of the happy ball because serotonin is a happy hormone. So that's why here I showed with the red color. See here, and decreases the sensitivity to pain. See, neurons will not feel any sensitivity. Sensitivity will be loose. Okay. And it is important to increases the minimum blood sugar. See, if your blood sugar fall below the 100, you will be fell down. Low BP, low sugar level. Low sugar level, you will be fell down. In such a cases, this glucocorticoids maintains the 100. 130, if you cross, it is a diabetic. That is another part. If it is a less than 100, 90, 80, 40 like that, then this corticosteroids will increases the blood sugar level. Very important. And heighten the memory and attention. You will feel very, very alert, very attention, proper listening, proper understanding. Everything will be pakka. Okay, and increases the blood pressure. We know now vasoconstriction here. Due to that, BP will be rises. So normal BP must be there. If you are taking extra steroids, it is dangerous. And these all these are the actions of the glucocorticoid. Number of actions are there. Glucocorticoids is having a number of actions. That is your patience. How much you want to read, you can read. Okay, here I am giving in a shortcut. I am giving all the things. See here, pancreas, beta cell dysfunction, decreases the glucocorticoids. So beta cells are very important for insulin secretion. So what this beta cell dysfunction, that is one of the, so you will become a diabetic if you are using a glucocorticoids, you will become a diabetic. Okay, because it reduces the beta cell dysfunction, insulin secretion will be decreased, see here. And next one is bone, increases the bone resorption initially, decreases the bone formation, decreases the collagen synthesis. Okay, that is one of the drawback. Here also a drawback. Liver, increases the gluconeogenesis. Gluconeogenesis means formation of a glucose from amino acids. Okay, and decreases the insulin sensitivity, increases the lipogenesis, lipid formation will be more. Okay, your liver will become a fatty liver. Okay, lipid liver, fatty liver. Okay, and increases the insulin resistance, that is one of the negative drawback. Skeleton muscles, decreases the type, like that here you can see, decreases the glucose uptake. All these leads to increases the, you will become a diabetic. Okay, insulin sensitization, white adipose tissue, it acts on white adipose tissue also. WAT in short form it is called, as increases the adipose tissue mass. You will get a bulky mass, you will get fat, very fat you will get here. Okay, and increases the lipolysis, increases the insulin signaling. And if you want to see the running matter, here you can see the running matter. Carbohydrate metabolism increases the blood glucose level by gluconeogenesis, inhibits the glucose uptake. If you want to take a screenshot, carbohydrate metabolism, protein metabolism, fat metabolism, mineral metabolism, water metabolism. Okay, and mineralocorticoids. Example is aldosterone, all minerals. That is a keyword. Okay, see all these potassium, calcium, magnesium, okay, sodium, all these will be absorbed back by the aldosterone. Aldosterone is example of the mineralocorticoids. So regulation of electrolyte, all these called as a lights for our torchlight. How torchlight is, these are all lights for our body. Okay, torchlights like energy. Without minerals, you cannot get energy. Okay, modulation balance by modulating the ion transport in the epithelial cells of the renal tubules of the kidney. This is the renal tubule, you know very well. This is apron, glomerulus. Okay, and aldosterone is very, very important for the water also. Water also absorbed by the aldosterone, increases the BP. Yeah, these are the normal secretion levels, how much it is secreted. Glucocorticoids, example is cortisol, corticosterone, these are the examples. And this is a 5 to 30 mg daily secretions in our body. This is the mineralocorticoids. Mainly aldosterone will be secreted high, 5 to 150 microgram. Okay, and these are the sex hormones, androgens, progesterone, estrogen. Okay, normal secretion that comes in the androgen chapter. Here glucocorticoids, mineralocorticoids, very important. This is number of times it was appeared in for 1 mark bit. Competitive examination, entrance examination, job entrance, any entrance. Synthetic hormone which is, natural hormone which is, all are steroidal hormones only. In the examination they will ask, find the synthetic hormone from the following options. These are the betamethasone, prednisone, prednisolone, dexamethasone. All these are the synthetic. These are the natural. Cortisol, corticosterone, cortisone, aldosterone. Okay. So all the mainly C will come generally, all those things. Okay. Cortisol, cortisone, corticosterone, aldosterone. Okay. It is naturally produced in the body, like AC you can remember. Okay. And important, this is also important, topical route. This is a classification based on the injectable. See, these are the betamethasone, prednisolone, hydrocortisone, dexamethasone. These are all you can give in the injection form also. Oral, betamethasone, prednisolone, methyl. This is also very important in competitive examination. Topical route. Okay, betamethasone is all topical. Okay, and inhalation for asthma, especially beclomethasone, budesonide. This number of times it was appeared. Beclomethasone, budesonide, flunisolide. Okay. Yeah, therapeutic uses of this corticosteroids. Diagnostic, dexamethasone is also used as a diagnostic agent. Replacement therapy of Addison's disease. Main, very, very important for exams. Addison's disease, that I will show you what is Addison's disease in the next slide. Life-saving indication. These are the three important things. Okay, like acute Addison's crisis, same Addison's. Okay, anaphylactic shock. Okay, and rheumatic disease, rheumatic like a joint pains, in knee joint pains, rheumatic pains. They are giving these steroids for a long term. You are using. Okay, renal disorders, allergy, skin, GAT, hepatic, ocular. Okay, malignancy. That is in the malignancy. I have told it is a cancer. Okay. Allergy I have already told it is immunosuppressants. Allergy is due to the immune system. Okay, here allergy it suppresses. Okay, we know very well. Addison's disease. Here, this is the symptoms of the Addison's disease. Bronzy pigmentation of the skin. Okay, changes in the distribution of the body hair. Okay, hypoglycemia. Okay, postural hypertension, weight loss. Okay, all these are the Addison's disease. In such a case, you can give a treatment with the glucocorticoids. Toxicity. If you are taking extra, what happens? It leads to Cushing's syndromes. Don't take extra steroids. Don't. Hypertension. It leads to hypertension. Electrolytes, over electrolytes in the body. Abnormalities will be there. Edema will be there in our body because all will be retained in our body itself. Hyperglycemia, glycosuria, glycosuria. Glucose will be there in the urea like that. Glycosuria, supra infection, prone infection, osteoporosis, weakness of the bones. Okay, porosis. Hello, okay, myopathy, psychosis. You will become a mental psychosis. Okay, glaucoma, heart, eye, and cataracts formation. Very dangerous. Don't take steroids in extra in the form of this is the Cushing's syndrome. Your body will become like this if you are taking extra. Why this is called Cushing's syndrome? Just like a cushion. Here you can see now two cushions. See, wherever you see body, this is one cushion. Here also one cushion. See my cursor. Cheeks like a cushion. Here this is also like a cushion. This is also one cushion. Total body will become like a bed, Dunlop bed. Okay, is you need this type of body. Don't. So that's why don't take extra. And these are the adverse reactions: peptic ulcers, growth arrest, acne, hirsutism, topical, loss of skin collagen, inhalation, harshness of a voice. You will get over harshness of the voice if you are taking androgen. Okay. So, and here you can see the individually, very, very important. First one is a hydrocortisone. This hydrocortisone, you keep it, this RSGM as a signal. It is a short duration, rapidly. See here, R rapidly, short duration of action. Short duration, rapidly absorbed, but short duration, only small time, a very little time it will. Okay, primary. In addition to this, primarily it is a significant mineralocorticoid activity. See here, this is a glucocorticoid plus mineralocorticoid activity. That's why I have shown the glucocorticoid, significant mineralocorticoid. Both glucocorticoid plus mineralocorticoid actions will be there for this hydrocortisone. Okay, it is used in the treatment of ulcerative colitis. Okay, and also used as a asthma. See here, asthma, and also used in the shock. Okay, so with the help of these images, we can remember easily. Here you can see hydrocortisone. See, this is hydrocortisone. No? Hydrocortisone ointment, topical application is available. Injection. This is a hydrocortisone injection by the Abbott Laboratory, very famous, very popular, world toppest pharmaceutical company, Abbott Laboratories. Prednisolone. Prednisolone, it is a more potent. See here, that's why here I shown prednisolone is equal to 4 times greater than the hydrocortisone. First we saw hydrocortisone. Okay, this is 4 times greater than the hydrocortisone. That's why this is they are giving as a knee pains. It is available in the intra-articular injection. It is very powerful. Your knee joint pains will be reduced immediately. You will get relief for a period of 15 days, 20 days like that. Again, you have to take the injection like that. Some okay, and this is used for the allergy since it is a very potent, rapidly decreases the immune system so that you will not get allergy. It is a very good anti-inflammatory drug, autoimmune diseases. Okay, in such a cases you can use this type of a thing. Autoimmune disease means your immune system will be do some overaction. In such a cases you have to reduce the immune system. Okay, in such a cases you have to give a prednisolone. I have already told all corticosteroids are having a immune system suppression. This is a prednisolone cream, topical, and this is an injection. And methyl prednisolone is a slightly more potent than the prednisolone. This potency also they will ask in the examination. This prednisolone is 4 times greater than the hydrocortisone. Methyl prednisolone is some more potent than the prednisolone. So this is most powerful than the two. Okay, so you have to practice in this matter is all from pharmacology of Tripathi book only. Okay, ulcerative colitis, same what we have, retention of edema. See, kidneys are very important in the edema. Renal transplantation, very, very, very important. That's why here I have shown the kidney transplant. One additional kidney is there. See here, kidney is transplanted, extra kidney. In such a case, what happens? Your body will try to reject the new kidney. Your body immune system will not accept the, because your body treats that extra kidney as an antigen. So it produces all antibodies. So there is a big fight between antigen antibody, and our body try to reject the new kidney. In such a cases, you have to reduce your immune system. Okay, okay, don't fight. It is my kidney. It is for my good sake only. I brought kidney like that. Methyl prednisolone you can be used lifelong. Kidney transplantation, methyl prednisolone you have to use a lifelong. Okay, you have to reduce immune system. If you reduce immune system, again chances of getting some other diseases will be increased. Nothing. Okay, you have to get it. Okay, this is methyl prednisolone acetate injection. Triamcinolone, this is especially for intra-articular, that is injection. What we have shown, no? Triamcinolone, T-A-R-Y, like that you can remember. Try in your knee joints, triamcinolone. Alone you take the injection. Triamcinolone, alone he is taking injection. He is trying injection to reduce his pains. Like that you can remember. And dexamethasone and betamethasone. These two are almost equal. And it is available in all routes. That is very, very important. So beauty, betamethasone. Beauty means betamethasone. Dexa means dexamethasone. So butamethasone, dexamethasone, all routes. Beauty and dexa is there in all routes. Okay. And this is a very long acting. That's the important point. Very, very long acting. It is used for the inflammatory allergy condition, shock, cerebral edema. That is a highlight. Edema. Water will be there in your cerebrum. It is the biggest problem. Okay, it is also used topically. Here dexamethasone ointment is available. Okay, here betamethasone ointment is also available. Both are safe. Okay, so thank you. I will end my video here. Okay, if you have any doubt, repeat and rewind the video.